But there are actually two really big experiments where one was run by the Rand Corporation in the 1970s, and the other was more recent in the early 2000s. Basically, Oregon had like closed its Medicaid rolls, like the number of people who could enroll in Oregon Medicaid for a while. And they had some money that they could use to bring more people into Medicaid, but they had way more people who were like on the wait list than they had money to cover, right? So what they did was they said, okay, we'll actually like randomize among the people on the wait list, we'll actually randomize like who gets it and who doesn't, and we'll see what happens to them. Basically, you know, people are much more likely if you give people health insurance, then they pay less when they go to the doctor and when they go to the hospital, and people are much more likely to go to the doctor and go to the hospital, right? That may be good or bad. You know, certainly I think if you talk to or if you sort of take seriously the line that comes out of Republicans in this conversation, right, about like, you know, we want to add copays because we think that's bad, right? We think that there's like too much healthcare consumption that happens when people have health insurance, but there are lots of reasons, like you're saying, that people really need a bunch of healthcare, and if they don't get their insulin or they don't get their you know, sort of regular treatments for high blood pressure or something, right, it could cause really big problems. And I don't think people are like over consuming insulin just for the fun of it.